What happens to the prostate of men who masturbate every day? Discover the changes, gentlemen. Let's be honest. This is one of those topics most men never say out loud but think about all the time. What really happens to my prostate if I masturbate every day? You've probably seen the rumors online or heard the locker room whispers. It drains your energy. It causes prostate problems. It's bad for men after 50. And because no one ever gives a straight answer, that quiet worry lingers in the back of your mind. I see it every week in my clinic, strong, hard-working men in their 50s, 60s, and 70s who whisper the same question. Dr. Laura, am I hurting myself? They feel embarrassed even asking, as if curiosity about their own body is something to be ashamed of. But here's the truth. Silence is far more dangerous than the act itself. When men don't understand how their body works, myths and fear take control. And fear can quietly ruin your confidence, your energy, and your relationships. So today we're breaking that silence once and for all. Because your prostate isn't fragile. It's not some ticking time bomb waiting to explode. It's a living, reactive gland, one that depends on healthy circulation, hormonal balance, and yes, regular release. The truth is, your body was designed to use that system. When you ignore it, you don't save energy, you create stagnation. Just like a car engine that sits unused for months, the prostate needs gentle movement to stay clean, functional, and strong. Now, I know what some of you are thinking. Dr. Laura, are you telling me to just do it every day? Not exactly. Frequency isn't a magic number. What matters most is how you do it. Mindfully, gently, without shame or compulsion. When done in moderation and with awareness, ejaculation acts like a natural flush for your system. It helps remove old cells, reduce inflammation, and support a healthy hormonal rhythm. The bigger problem isn't the act, it's the guilt surrounding it. Guilt raises stress, stress raises inflammation, and inflammation is the enemy of every man over 50. The moment you drop that shame and start seeing your body as an ally instead of an enemy, everything changes. You sleep better, feel lighter, and regain that quiet confidence you thought you'd lost. So before we dive into the science, I want you to make me one promise. Stop apologizing for being human. You're not broken. You're not weak. You're simply learning what no one ever taught you about your own biology. And that, gentlemen, is power. I'm Dr. Laura, and this channel exists to help men like you reclaim their health, energy, and confidence. Without pills, without shame, and without confusion. Hit like, subscribe, and drop your questions in the comments so I can help you directly. In the next part, we'll dig into the real science. The studies that prove how daily release affects your prostate and why what you've been taught to fear might actually be protecting you. Now let's talk about the science, gentlemen, because facts are far more powerful than fear. For decades, men everywhere have been told the same outdated warnings. Masturbation weakens your prostate. It causes inflammation. It raises your cancer risk. Those words stuck generation after generation, until most men simply accepted them as truth. But when scientists finally started digging into the data, the results flipped that old narrative completely upside down. One of the most important studies came from the Harvard School of Public Health and was published in European Urology. Researchers followed more than 30,000 men for nearly 20 years, studying how ejaculation frequency affected prostate health. The outcome was astonishing. Men who ejaculated about 21 times per month, that's roughly 5 times a week, had up to a 33% lower risk of developing prostate cancer than those who ejaculated only a few times a month. Let that sink in. The very thing you were told to avoid might actually be protecting you. And the explanation is surprisingly simple. Every ejaculation acts like a natural flush. Your prostate constantly produces fluid to nourish and transport sperm. When that fluid sits stagnant for too long, it thickens, traps toxins, and increases inflammation, like a pond without movement. Regular release keeps the system clean. It reduces internal pressure, prevents buildup, and supports healthier cell turnover inside the gland. But the benefits go beyond biology. There's an emotional and psychological layer to this as well. Many of my patients over 50 tell me that when they maintain a healthy release rhythm, whether through sex or masturbation, they feel calmer, more balanced, more confident. That's not a coincidence. Sexual release triggers the release of dopamine and oxytocin, the same feel-good hormones that reduce stress, improve mood, and promote restful sleep. And when your body rests better, your prostate heals better. Now let me make one thing clear. There's no perfect number. You don't need to hit 21 exactly or track it like a competition. Every man's body is unique. What matters most is consistency and mindfulness. Daily release is healthy if it feels natural, not forced or compulsive. You should feel recharged afterward, not depleted. And here's something worth remembering. Guilt is far more harmful than the act itself. Shame raises cortisol. Cortisol fuels inflammation, and inflammation is the root cause of most prostate and hormonal problems. So if you've been carrying guilt, it's time to drop it. Your body isn't something to fight against. It's something to understand, respect, and work with. So, gentlemen, the science is clear. Masturbation done mindfully isn't a weakness. It's part of your body's maintenance system. In the next part, we'll go deeper inside your body after 40, exploring the 3 major biological changes your prostate goes through, and how regular release fits perfectly into keeping it strong, balanced, and pain-free for decades to come. Hit like, subscribe, and stay with me because what you'll learn next could change how you see your own body forever. After 40, your body begins to change in quiet but significant ways, and your prostate is one of the first places where those changes appear. You may notice subtle shifts at first, getting up once or twice during the night to use the bathroom, a weaker stream, or a bit less energy and drive than you used to have. It's easy to brush these things off as just age, but beneath the surface, a series of biological transformations are taking place. They're not a sign of weakness or decline. They're simply your body adapting to a new phase of life. And when you understand what's happening, you can work with your body instead of fighting against it. The first major change is enlargement and fluid retention, what doctors call benign prostatic hyperplasia or BPH. The prostate is a small gland that sits just below the bladder, surrounding the urethra like a ring. As you age, hormonal shifts cause the cells within the prostate to multiply, slowly increasing its size. This growth isn't cancerous, but it does create pressure on the urethra, which can make it harder to fully empty your bladder. That's why so many men experience a slower stream, dribbling, or the constant urge to urinate, especially at night. Inside the gland, old secretions can also build up, creating inflammation and that dull sense of heaviness many men describe but rarely talk about. When you ejaculate regularly, you're essentially clearing those ducts, flushing out the old fluid and helping the gland maintain better circulation. It's basic maintenance, but it makes a real difference. The second change involves your hormones. Around your 40s, testosterone levels naturally begin to drop, while another hormone, dihydrotestosterone, DHT, starts to rise. DHT is more potent than testosterone and acts almost like fertilizer for the prostate. Too much of it accelerates tissue growth and contributes to swelling. At the same time, low testosterone can leave you feeling more tired, less focused, and less motivated. This combination creates the perfect storm for both physical and emotional frustration. The good news is that consistent, healthy ejaculation helps regulate this balance by lowering DHT levels and supporting smoother hormonal turnover. It's not a miracle cure, but it's part of how your body keeps the endocrine system flowing efficiently. The third major change is what I call the cellular renewal slowdown. Every day your prostate cells divide, regenerate, and replace themselves. Over decades, small errors, tiny mutations, can occur during that process. These aren't dangerous on their own, but when they build up due to chronic inflammation or oxidative stress, the risk of abnormal cell growth increases. Regular release helps by promoting circulation, reducing stagnation, and flushing out toxins that can trigger inflammation. Think of it like cleaning a coffee maker. When it's rinsed regularly, it runs smoothly. When it's neglected, residue builds up and problems appear. These 3 changes, enlargement, hormonal imbalance, and slowed cellular renewal, are part of the natural story of aging. But they're not destiny. The prostate responds beautifully to care, consistency, and attention. When you understand how it works, you realize that staying healthy isn't about resisting time. It's about cooperating with your body's own design. Now that you understand what's happening inside your body, it's time to turn that awareness into action. Knowledge without application changes nothing. The men who age well aren't the ones with perfect genetics. They're the ones who take consistent, intelligent care of themselves. That's why I teach every patient what I call the 6-pillar prostate protection plan, and in this part we'll walk through the first 3 pillars: annual checkups, an anti-inflammatory diet, and movement. These are simple, practical, and incredibly effective. The first pillar is annual medical checkups. I know, no man enjoys this one. The idea of visiting a doctor for a prostate exam can feel awkward or even humiliating. But I'll tell you the same thing I tell every man who sits in my office. Those 15 seconds of discomfort could save your life. After age 40, your prostate begins to change rapidly, and symptoms don't always appear early. A yearly checkup that includes a PSA blood test and, when necessary, a digital rectal exam can catch issues long before they become dangerous. Early detection isn't just about preventing cancer. It's about preserving your quality of life, your sleep, your energy, and your peace of mind. I've seen men in their 70s who stayed healthy simply because they didn't skip their screenings. It's the easiest form of prevention you'll ever do. The second pillar is an anti-inflammatory diet. Your prostate hates inflammation, and what you eat either fuels it or fights it. Processed meats, fried foods, and refined sugars act like gasoline on that internal fire. On the other hand, foods rich in antioxidants and healthy fats calm the gland, reduce oxidative stress, and support hormonal balance. Focus on colorful vegetables, fruits, whole grains, fish, nuts, and olive oil. And here's a secret weapon: tomatoes. When cooked, tomatoes release lycopene, a powerful antioxidant proven to protect prostate cells. Even something as simple as tomato soup or pasta sauce can become a natural defense. Add a handful of pumpkin seeds or walnuts each day for zinc and omega-3s, nutrients that keep prostate tissue resilient. Eating well isn't about restriction. It's about giving your body the fuel it needs to heal. The third pillar is movement. You don't need to be an athlete to benefit from exercise. You just need to move your body every day. Physical activity improves blood flow, which is essential for prostate health. It balances hormones, supports testosterone production, and prevents fluid stagnation in the pelvic region. 30 minutes of brisk walking, swimming, or cycling most days is enough to make a measurable difference. Add light strength training a few times per week to protect muscle mass and metabolism. And yes, men can do Kegel exercises too. They strengthen the pelvic floor, improve urinary control, and enhance circulation in the prostate area. Movement is medicine, and consistency is far more important than intensity. These three pillars, checkups, nutrition, and movement, form the foundation of a healthy prostate. They don't just prevent disease. They help you reclaim vitality, confidence, and control over your own body. And once these habits are in place, the next three pillars, hydration, stress control, and healthy intimacy, take that foundation and turn it into long-term resilience. With the first three pillars, checkups, diet, and movement, you've built a strong foundation for a healthy prostate. But to truly protect your gland and keep your vitality high well into your 60s, 70s, and beyond, you need to address three equally important elements that most men completely overlook: hydration, stress management, and healthy intimacy. These aren't luxuries, they're essential. The fourth pillar is hydration, and it's one of the simplest yet most underestimated factors in prostate health. Water keeps everything in your urinary system flowing. When you're dehydrated, your urine becomes concentrated, irritating both the bladder and the prostate. Many men make the mistake of barely drinking during the day, then chugging large amounts of water at night, only to wake up 3 or 4 times to use the bathroom. That pattern disrupts sleep and increases fatigue. The smarter approach is to hydrate gradually throughout the day. Start each morning with a full glass of water before your coffee. Keep sipping every hour or so, especially in the afternoon, and reduce intake after 7 p.m. Aim for 2 to 3 liters total. You'll notice your urine lighten in color and your nighttime awakenings decrease. Hydration might not feel dramatic, but it's a daily investment that helps your prostate stay calm, clean, and pain-free. The fifth pillar is stress control. Most men underestimate how destructive chronic stress can be. When you live in a constant state of tension, worrying about work, finances, family, or even your health, your body floods with cortisol. That hormone increases inflammation, throws off testosterone, and directly irritates the prostate. It's no coincidence that many men report flare-ups during stressful periods. The solution isn't to eliminate stress. It's to regulate your response to it. Start with deep breathing, meditation, or simply a quiet walk outside each day. Spend more time with people who make you feel calm instead of drained. And most importantly, make sleep non-negotiable. 7 to 8 hours of quality rest each night helps your hormones reset and your body repair itself. Remember, rest is not weakness. It's biological maintenance. The calmer your mind, the healthier your hormones, and the stronger your body becomes. The sixth pillar is healthy intimacy, which includes both sex and masturbation. Intimacy isn't just physical. It's a core part of your hormonal and emotional health. Regular, mindful release helps regulate blood flow, balance testosterone and DHT, and flush toxins from the prostate. It also lowers stress and supports deep sleep. But the key word here is mindful. Gentle, present, and intentional release is beneficial. Compulsive or rough habits, especially at an older age, can have the opposite effect. Your goal isn't quantity, it's quality. See your sexual energy not as something shameful, but as a vital part of your body's maintenance system. Whether it's shared with a partner or experienced alone, intimacy should feel grounding, not draining. These next 3 pillars, hydration, stress control, and healthy intimacy, complete the system your body was designed to follow. They connect the physical and emotional aspects of your health, bringing balance to your hormones, circulation, and confidence. When combined with the first 3, they form a powerful, sustainable plan for a prostate that functions smoothly and a life that feels strong, clear, and free. Gentlemen, let's take a moment to zoom out and look at the bigger picture. You've spent your life pushing forward, providing, protecting, solving problems, and taking care of others. But somewhere along the way, no one ever taught you how to take care of yourself in the same way. When it came to your prostate, your hormones, your energy, you were told to just deal with it, or worse, to stay silent. But silence doesn't protect you, it isolates you. And the truth is, real strength isn't pretending nothing's wrong. Real strength is curiosity. It's the courage to ask questions, to learn, and to adapt. Everything we've talked about, daily release, clean nutrition, exercise, hydration, rest, and mindful intimacy, comes down to one simple truth. Your body isn't failing you, it's talking to you. Those subtle changes you've been noticing, the slower stream, the lower drive, the restless nights, they're not signs of weakness. They're messages. Your prostate isn't your enemy. It's a mirror of your overall health. And when you start treating it with respect instead of fear or shame, it rewards you with clarity, energy, and peace of mind. You've learned that ejaculation isn't the villain culture made it out to be. It's part of your body's maintenance system, your natural way of keeping things clean, balanced, and functional. You've also learned that no single habit is a magic bullet. It's the combination of consistent choices that builds resilience. Getting your checkups, eating foods that fight inflammation, moving every day, staying hydrated, managing stress, and staying connected to your body, your partner, and your purpose. These aren't separate tasks. They're the architecture of health. I've worked with men in their 50s, 60s, and even 80s who thought they were too late to change. They'd already accepted sleepless nights, weak flow, low energy, and the loss of intimacy as just part of aging. But after 30 days of following the pillars, eating smarter, moving regularly, hydrating consistently, and practicing mindful release, the difference was undeniable. They slept through the night. Their mood improved. Their confidence returned. What changed wasn't just their prostate, it was their mindset. They stopped viewing age as the end of vitality and started seeing it as the beginning of mastery. So here's my challenge to you. Give it 30 days. Follow the 6 pillars. Treat your prostate like the vital organ it is, not like a burden. Let go of guilt, drop the shame, and start listening to your body again. Within weeks, you'll feel the difference, not just physically but mentally and emotionally. You'll realize that aging doesn't strip you of masculinity, it redefines it. It gives you the wisdom to care for yourself in ways your younger self never knew how. I'm Dr. Laura, and I want to thank you for having the courage to ask the questions most men never do. Hit like, subscribe, and check the pinned comment for my full 30-day prostate health guide. Because gentlemen, your best years aren't behind you, they're just beginning. And this time you'll walk into them with knowledge, confidence, and the power that comes from understanding your own body.